Whoa, okay. All right, Ms. Salmon, one of the things that you talked about is that throughout this entire experience, you lost there was some disfiguration of parts of your body. Was it just your face or was it other parts of your body?
It was just my face. It was specifically the right side of my face. I lost it. It is called facial palsy, where you lose. It is some sort of a paralysis that that took over. It affected my eye, my speech, and the feeling on the right side of my face. And to this day, I'm still the right side of my face is still numb. There is some palsy. My right eye does not close properly. And the other thing as well is that there's this constant, I'm deaf in my right ear, and there's a constant ringing in the ear, similar to, I don't know, two metal tuning forks always, there, or there are times where it just feels like water rushing through.
All right. So from the perspective of a woman, did that present any trepidations for you, having lost or suffered some disfigurement, a facial disfigurement?
At first, it probably did. It was not something I was focusing on, though. I was probably because I was learning how to walk, learning how to, use utensils again, learning how to even just standing up straight without falling over, leaning over on my right side. I came out of the hospital. I went into the hospital being able to walk straight, at least I thought I did, and I came out not even being able to stand on my own 2 feet, using a wheeled walker to get around, seeing doubles out of one eye. I was called Magilla Gorilla at one point, jokingly. That's that's I guess that's how horrible distortion was, and my concern was not about my face, because whether it was going to be permanent or not, it's something I would have to deal with. Mine was making sure that I could actually just function day to day, just to see my family or continue raising my family. That was what was important to me, not my facial features. I didn't dwell on that. It would probably have sunken in at some point if it didn't start getting better, which it did miraculously start getting better, probably about 6 weeks after I left the hospital.
So when you say you were called a particular name, was that in the workplace or was it?
No. It was just in conversation. Just to let you know, after surgery, I could not leave my bed for 2 weeks, and I was never given a mirror. I did not know what I looked like. All I recall was that I was drooling a lot. The doctor did not, he told me that there was some facial palsy, which I didn't question what that was. I thought it was just part and parcel of, my skull being pulled forward, so it was going to go back to the way it used to be. So I just left it, and I know that when I got home, we were in conversation one day with, because I had to learn how to use a knife and be able to use a knife and not cut my fingers off. And I remember my niece and my son said something to me and said, "Wow, you've come a long way. You used to look like Magilla Gorilla." And, we all started laughing. They did apologize for it. But when I questioned everyone that came to the hospital to look for me, they said, yeah, and they had actually thought I knew what I looked like, but I didn't know. I literally didn't know what I looked like. At that time, my right eye never closed. They would put a Vaseline type treatment on my eye every night just to prevent it from getting dry.
So just to be clear, when you actually went back to work,
Mm-hmm.
the transition from being ill to back to work or back to assuming some of your functions, did you notice your coworkers' attitudes towards the disfigurement?
No, I wore glasses and I also wore a hat because my head was half of my head was shaved. No, they were just very hovering and more. One of the things they did was treated you as if you were fragile, and I needed to retain my independence. So I somehow would rebuff that at all costs because I did not want anyone coming to a pity party when I was there. So I tried my best, to. If I had to only spend 2 hours in the office, it would be 2 productive hours. I wouldn't try, over that 6-month period, I wouldn't try to do a full day because I know it was just beyond me. And I was still in severe pain. The headaches were still there. The healing was still going on. There was a lot of nerve endings happening in my face. And it was visible when it would happen at times with the facial tics and so on. So I tried not to be around people because to me it was uncomfortable, it was painful, and I was still on medication for quite a while after the surgery.
So when you say that you didn't want to be people coming to a pity party, mm-hmm. Are you saying that one of the things that often happens in the workplace when people go back to the workplace after an illness of this kind, that they start to focus on your illness and you become sort of your identity becomes the illness, and that is frustrating for you? Is that what you're saying?
It was, and at all costs, I didn't want that to be Lavern, the brain tumor, I guess survivor. I didn't want that to. I still wanted to be Lavern, the manager, or Lavern, the employee. It was very important for me to maintain that.
Why? Tell me why. From the perspective of an employee, mm-hmm. Why would it be so important for you to maintain the identity of an employee mm-hmm. prior to going on to the surgery as opposed to this post-surgical look that you had? Why?
Because I never... again, it comes back to that pity party. I didn't want anyone pitying me and taking it easy on me. I think I probably needed to prove to myself that I can still operate. Possibly on the same level as when I left. It was important to also, I guess, still have the respect of my staff. Maybe in hindsight, it was probably not the thing to do, but I needed to do that for me. I was not going to take the easy road, and I could have. I didn't take the easy road. I just went out and just kept performing the way I did,
So how do you sort of put employees in their place when it becomes too much to deal with yourself? They're seeing you in this post-surgical light, which they're taking pity. They probably don't know the impact of what they're doing. How do you correct them so that they understand psychologically what's important for you?
I actually voiced that I didn't want to be treated differently, and I also advised that I was coming back slowly, and I needed to be treated the same way as pre-surgery. I think if I'd fallen into the pity cycle, I would have done myself a lot of injustice. My recovery would have been lengthened. I needed to still perform and not be allowed to have things slide, because here I was, quote unquote, and I don't want to call it disability, but I'm going through this, devastating thing in my life, and I didn't want anyone saying they're going to throw me an easy ball so that I could cope, because that doesn't teach you anything, and it wouldn't have taught me anything. So I needed to come back and just so that I could function as best as I can. Once again, my memory was out there. There were things that, thank heavens, I had 3.5 months to write things down and, make sure that notes were in place so that I could go back and refresh. So that most of that period of time, that's what I was doing, just familiarizing myself with a lot of things that had happened, the work that I used to do. And you know what? There are things that I take and memory would just start flooding back, and as long as you concentrate on it, but it was a work in process. It literally was.
I'm fascinated by this pity issue, because on the one hand, people they're concerned about you.
Yes.
Right? Mm-hmm. They want to know how you're doing.
Yep.
And so they'll come up and ask you, so how are you today? Are you feeling, how you feeling? And they want to engage, but you're not receiving it that way all the time. Or maybe from certain people you receive it that way and not others, right? So what makes the difference? Like, how do you strike that balance between, someone caring and demonstrating their care and crossing over the line to a pity party? In the workplace. You
would sense that. You would genuinely sense when someone was when someone was genuinely caring. At least with me, I can sense when someone is genuinely caring about me in my office, as opposed to someone who wants to diminish the fact that, you've got a brain tumor, you've had surgery, you can't be the same person that you had been. You're probably operating on, half, your glass is half empty instead of half full. I didn't want that. And there were people that were malicious. There were people who tried to show you up. And you just need it. But that's in all walk of life. And I was not going to fall into that. So for those who came in and were genuinely concerned that, try and take it easy, try not overexert yourself, don't stay in the office too long, versus those who, well, why are you back so quickly? Why are you doing this? So you need to just, I was able to just differentiate the ones that genuinely cared versus the one who would try to undermine my situation at the time.
I'm intrigued by the distinction that you make, where you say that there were some who were malicious.
Malicious, yeah.
Organizations, workplaces are by definition political places, right? And organizational politics come into play with virtually anything, illness included. Mm-hmm. So in the process of trying to distinguish maliciousness from genuine care, how does the organizational politics that you knew prior to going to the hospital, how did that play into you deciphering and labeling one person being genuine versus the other one being malicious? Or was that even a factor?
Okay, how do I diplomatically answer that? Look, I guess all through one's career, one will always have someone that is eager to step into their position, and one has to be very mindful of how you, and I'm still going to be very mindful of how I actually answer that question. Look, there were two people that were just knocking on the back door who wanted my job. And they were the ones who consistently undermined my quote-unquote abilities, second-guessed everything I did during that time, wanted to encourage me to take the 6 months off work that I was given, and did everything in their power to make sure that if decisions needed to be made, and if I didn't need to be there to make those decisions, that I was never informed that things were happening that required input that would be of value to me when I returned. So those were the ones who you're mindful of, and my staff. I had the rest of my staff, I had a fantastic relationship with them. I still do to this day. It's been 15 years, and I still get along very well with them. And they were the ones who were more, I guess that's what I meant when I said I didn't want the pity, because they would come into my office and, things like getting coffee, taking away my coffee mug when it's when I'm done, bringing me lunch. If I needed to go to the bathroom because I had a walker, they'd walk with me. I needed to be independent, and I tried as much as I can to divorce myself from that, because if I depended on them, yes, it was going to take me a full 6 months to recover, as opposed to the time frame that I had mentally given myself, which was 3 months.
All right. So, again, I'm intrigued because there were two people, you say, that were standing in line for your position.
Mm-hmm.
Organizational politics, right?
Yeah. Mm-hmm.
All right. So, from a managerial perspective then, if a manager is aware that political stuff is happening and you're now back at work trying to cope, what do you tell managers? How do they manage that politics in the face of a employee who's come back to work after suffering from, this debilitating experience and is trying to cope, but organizational politics still goes? How does the manager manage that? What do you tell managers today?
Make sure that you are well connected with your upline. Make sure it's not a popularity game, and I think that's where these two individuals were coming from, trying to curry favor. It wasn't on abilities at all, and at the end of the day, that's what resonated to my boss, with my boss. I think the rest of the management team realized and recognized that prior to my leaving, that there was one individual who started beating their chest, thinking that they were going to be named manager while I was gone. That did not happen. The other person was a senior staff member who thought that she was wrongfully done by several other managers, and felt that after years of service that she could actually just wheel into the position and take over. So there were no leadership skills there. I don't think I felt threatened. Matter of fact, I don't recall being threatened. I just went along with the games, and it was things that management discussed with me, my boss discussed with me, to tell me that they realized that these undertones were going on, not to pay any attention. And that's one of the reasons why I think I was asked to come back into the office. It was initially just a day a week, then it was 2 days a week, then 3 days a week, just for 2 hours, and then it was for a full week, just for 2 hours, and then I just weaned myself back into full time by the end of 6 months.
All right, so it's interesting that you said that one of the things that comforted you that your manager or managers did was they talked to you about the politics and assured you that everything would be okay.
Yeah.
All right. What were 4 other things that they did well from your perspective as a manager? 4 other things that they did well during that period of time. I was always, what was important too as well, I was always still referred to as a manager even when I was actually off duty. That was number 1. Number 2 was that I was always copied into all their managerial communications. They also allowed me to communicate with my staff even while I was home. They gave me the tools to do so, email, my cell phone. And any major decision regarding the departments that I ran were left for me to come back and make. They would defer certain things for me. I don't recall anything major happening between March and May where decisions were made where I was not part of that decision process. 4 things. So for you then, what's most important from a managerial perspective was that the manager not only talked to you and assured you, but remained inclusive in terms of not sidelining you,
right,
to the extent that you could be part of the decision. You got the information and they left it up to you for you to participate according to your level of ability at that point, right? What were some of the things that management did wrong in terms of managing the organizational politics as you went through the illness? I'm not suggesting that there's anything that they did wrong.
Honestly, I can't recall. The 4 things that you asked me about that I saw as positive, other people would probably see as some negative in there, because they also left the burden of running a department on my shoulder. They left the day-to-day operational leadership to, someone else. But when it came to running the department, it was left up to me to still continue doing so. Believe it or not, I spent 2 weeks in the hospital. On the third week I was out, and that third week I was being called on to make decisions that annoyed my family member. My husband in particular. And I deferred those decisions to the acting manager at the time.
Okay, so the obvious question is, why did it annoy your husband?
He felt that if I had, dropped dead, that decisions would have been made without me being there. And I had a relapse, so I wasn't totally out of the woods yet. And he did not want anyone disturbing, I guess, my rehab at that time.
All right. Is there anything else that you want to talk about in terms of the organizational politics? As I'm going to wean it back into the pity party piece, because I'm going to ask you now about whether or not the attitudes that you experienced from co-workers, fellow staff, your subordinates, was there a difference between how men treated you and how women treated you in the workplace? Did you observe any difference?
I work with gentlemen, and that's all I can say. The men who would open the door and pull your chair out. I did not see any, to me anyway. I felt I was treated the same way because I begged for that, and I made sure that my first meeting, my first day back full-time, that I asked, please don't treat me any differently than you did. The only thing I ask is that I'm deaf in one ear now, so you're going to have to speak loudly or speak in front of me, but not to my right side. Those were the only transition or differences allowances that I asked to have made. There were some things that I was a little bit slower to respond because I had to think things through a little bit longer than I usually do, where I wasn't right on as quickly on the mark as I wanted to be. My treatment from my colleagues, my peers, I don't know that there was. I know that later on there were some difficulties, but not pertaining to my illness. It had to do with other things.
Okay. All right. So if you had to summarize the lessons that you learned from going back to work with a visible impairment and how staff there treated you, what would be the 5 top learnings from your perspective?
If I had to summarize, from me personally,
yes,
positive attitude, always staying connected, once again, I'm going to stress this, that I planned for the worst and expected the best and prayed for the best and hoped for the best. Have the support of your colleagues, and just surround yourself with your family members, because they pull you through, and they pulled me through a heck of a lot. Without them, I don't think that I would really have been able to get back to work and be the person that I continue to be.
Ms. Salmon, thank you very much for this interview, and wish you all the best in your new endeavors, different endeavors, your rest of life. Thank you.
Did I cover everything there?